today I wanted to talk about things that people in cancer treatment or in remission will sometimes hear from others. The first thing, especially for young cancer patients like myself, is you're too young for cancer. And it's like you want to say, well, tell it to the cancer, because it clearly did not listen to that rule. Especially like those of us that are in our 20s or 30s, it's hard to hear that because you do see at every appointment you go to in the cancer center or the oncologist's office, everyone surrounding you has gray hair, and you're the one person who's young and often bald because we get kind of the toughest cancers, so we always go through chemo, it seems like. But one comment that I heard from one woman as a good rebuttal to that is someone would say to her, "You're too young to have cancer," and she would say, "And too beautiful too." So I really like that one. And then another woman, so these women are part of this online group that I associate with Young Survival Coalition. So another woman was saying, if it's your medical team that's making these kind of comments, like to say to them, well, that's not very helpful. What is something that you could say, like, to help me through this experience, since I am young and since it is, such a uncertain experience for me to go through? Because I think one thing that, of course, medical professionals, they do a really awesome job with, like, the physical effects, right? Like the physical part of dealing with cancer and physical side effects. But I don't think they're as attuned to, like, the emotional side effects, the mental health aspect. Actually, I have a story for that a little bit later that I'll talk about with my other ideas. But yes, I think that's something that's kind of tough, so that maybe makes them maybe think more about that other side a little bit, because of course they deal with people with cancer every day, but I think very few oncologists or oncology nurses have actually had cancer themselves, or maybe been, like, personally impacted by, like, a close relative. It probably has happened, but of course it has happened. There's, like, documented stories of people who've written books that were oncologists that had cancer, but I don't think it's that common that they would know from personal experience. Another thing that you'll hear is kind of like this idea, like, don't worry, like, try not to worry. So this is where my little story comes in. So, like, I trust my oncology team. I think they're awesome. They're great, but my oncologist said this one thing that was kind of funny. Like, one day he was telling me about, like, my future as far as a cancer patient goes, and basically saying, like, well, the cancer can reappear, like, in any part of your body at any time, basically. So reassuring. Thanks, doctor. But then, like, a few minutes later, he was like, oh, but don't worry, everything looks good. So just kind of that funny contrast where it's like they're telling you, like, well, like, be on the lookout because it could, come back somewhere else in your body, but at the same time, don't worry, relax, everything's fine, So I think that's kind of funny, that we have that contrast every day as, like, someone who's been through cancer. And I don't think I'm an overly anxious person by any means, but I have seen, like, my body has, like, some, like, physical anxious reactions now post-cancer treatment, like, where I'll feel kind of shaky before, like, a doctor appointment or just something like that I'm kind of working on, so we'll see how that goes. But I think there's definitely, like, some sort of maybe, like, mental or emotional trauma that your body goes through in treatment, and then sometimes you don't always catch up to it, like, you're maybe not dealing with it while you're in treatment, but maybe later on it kind of catches up to you. So I think we are entitled to worry if we want to, or maybe sometimes it's just like that. It's kind of like almost like a physical anxiety or something that kind of just sometimes gets the best of us, and I think we should just, like, be aware of that and try to figure out ways to help with that. So let's see, 2 other things I was going to say. One other thing is that people will say when you're in remission, like I am, I'm very grateful for it, but people will say to you, like, oh, it's gone. It's in the past, like, you're cured, hooray, like, let's celebrate, let's not think about it anymore. And yeah, I think it's valid to celebrate. It's valid to be really grateful for where you've gone so far and what you've made it through, and surviving just in general. All of that I think is really awesome to celebrate. But I think some people may not realize that, as there's a saying, like, once a cancer patient, always a cancer patient. I always have more doctor's appointments than the average person my age. I always get my blood drawn, every few months, maybe every year or so, once I get further on past this past treatment. I always get like a lot of more scans, and they'll just be more cautious about me in the hospital in general. I'll have that background. And then, of course, it's like, just like I mentioned with the not worrying situation, it's kind of always a part of who you are. It's always like in the back of your mind when you get some strange new ache or pain, like, is it back? Like, you guys have that like little worry, I think, which you definitely can. Like, I don't think it's like a fixation. It's not something that I'm worried about all the time by any means. It's not just the whole part of who I am, but it is a part of me. Like, I'll always be, I guess, a cancer patient in a way. I don't really like the sound of that. I guess survivor sounds stronger. Maybe that's why they use it so much, right? It sounds way better. But, so that's kind of just like a part of you, who you are, right? So, yeah, we do celebrate going past the active treatment section of life, but there's always like a small part of you, that has been through that experience. So it's always kind of a part of you. You don't really say you're cured or that you're past it. And the last one, this is like the hardest one. I don't really know how to deal with this. A lot of people will tell me, like, you're so brave or you're so strong, from going through treatment. And what do you say to that? I'm still trying to figure that out. I feel like I need to have like something wise to say when someone tells me something like that, because I don't feel like I was that brave. I feel like I just didn't have a choice. I just did what I had to do at the time, Like, when your options are die or go through treatment, you have to do treatment, right? It's kind of like the main thing to choose, the better option of the two. But I guess I just say thank you. I think we can also try to, I think when people say that, part of me thinks they're looking for, it's not like they're coming to you like you're this wise person, but it's almost like they are kind of wanting some sort of insight or some sort of, like, how do you deal with, difficult experiences? Like, maybe they want that advice, like, on some level, or they just have, a curiosity. Like, we're always curious about everything. So it's like, I feel kind of like I need to have some response that shows something that I did, maybe, that somehow helped me get through it. But I don't think I've come up with a good one yet. I think the best thing I could come up with is just like that when you're in the experience, you're just doing what you have to do. You're taking it day by day. You're not thinking too much about the far off future, just kind of more in the immediate time. But I think having people to talk to was a huge thing. Trying to find those support groups. Right now I'm really interested in being like a leader of some sort of support group, or something more like in person, or like in my region. I would really like to be some sort of like advocate or way to help women dealing with this experience too. Because I think having people like that just makes a huge difference. So, like, relying on people, having people around you that you can talk to. So I think those are some huge impacts. And then I think just doing things that relax you, being outside, being near nature was one thing for me, and then writing was another big thing. So being able to do the things that you love, it'll help take your mind off it a little bit when you're going through a difficult experience, like cancer treatment. And then it also, it just kind of like shows you something that you're passionate about, something that you love is still there. Like, no matter what, even in the hardest times, it can still be there for you. Yeah, so those are some of my thoughts.